Good evening, Facebook. So today is day 6 of my 25-day mental health awareness challenge. Once again, I'd just like to start by thanking everyone who has responded. Thank you for your feedback. That's really very helpful that the message is getting across. And for those who have in one way or the other got in touch with me to discuss things further, I really do appreciate your reaching out. Now, today I'm on letter D, and letter D is for, and in this case, it's going to be for depression. And before I go on to talk about depression, I'm just going to give a shout out again to my dear friend, Reverend Victoria Lawrence, who invited me or nominated me onto this challenge. Like I've said in the previous videos, she was herself nominated by her friend Antonia Justin. So let's talk about depression. Depression is a morbid state of sadness. It's not like any other form of sadness in which somebody receives bad news and they very quickly get over it. This is a state of sadness in which somebody is not able to shift it, and it's quite a very common condition. We do know that worldwide, about 264 million people suffer from depression. 264 million people. And we know that, for instance, in the UK in 2014, people who are age 16 and above, about 19.7%, nearly 20%, one out of every five, actually described symptoms either of depression or anxiety. So it's quite a common condition. It's commoner in women than men. So on the average, we know that more women suffer from depression than men do. But that's also very interesting, and I think I should just tick off that box now. That men sometimes present in a different way, and sometimes those symptoms are missed. Men can become angry. They might neglect themselves in a particular way. For instance, somebody just begins to grow a beard. I'm not saying that every man who grows a beard is depressed, but I'm saying that if a man is growing a beard, they are not maintaining it, and that's out of character for them, or they become very irritable and angry. Um, that might be it might be a sign that things are not going well and that more things should be looked out for. So going back to depression, there are certain cause, what we call core symptoms. Core symptoms are the key symptoms. They are the things that we need to look out for in order to make a diagnosis. So if somebody comes into the clinic or they see their GP, those are the things that one will be looking out for. So the first thing actually is sadness, and I've called it a morbid sadness. Morbid in the sense that it's a path. It's not a normal sadness. It's an abnormal type of sadness, like that one is not able to shift. And we do also know that that type of sadness usually occurs. It's usually worse in the mornings. People wake up feeling, oh God, it's another day, rather than thank God it's another day. And as the day goes by, they might also find it difficult to get out of bed because they can't face another day. But as things progress, they feel better. But that pattern is repeated over and over again, and it can last for weeks. When that symptoms persist for up to a 2 week period, then we know that there's some depression there. Of course, the other thing is loss of energy. For no apparent reason, somebody just feels weak and tired all the time. There's also lack of interest or pleasure or obtaining pleasure in the normal activities that would usually give them pleasure. I've cited illustration of a grandmother whose pride and joy used to be her grandchildren, but she no longer can stand the noise of children running around the house, or a man who is no longer can stand the watching Arsenal or Liverpool or whoever there, or rugby or cricket or whatever they really enjoy doing. So those are the main symptoms. However, there are other associated symptoms like poor sleep. The typical pattern that occurs in depression is what we call early morning awakening, in which somebody wakes up. They don't have problems going to sleep, but they have problems staying asleep. And that means that one will usually wake up about 2 hours earlier than one's normal waking time. However, there's also the other part of of sleep problems that people have, which can also be excessive sleep. So somebody sleeps throughout the night and they can very well sleep throughout the day. So that's important to note that it's not just problems going to sleep, it might be problems sleeping too much. The other thing about depression is that apart from sleep, there's also appetite. Usually, it's a poor appetite leading to weight loss. And when we look at weight loss, we are looking at maybe it becomes significant when at least 10% of the total weight has been lost. However, there's also a caveat that in terms of appetite, appetite could also be excessive, in which people eat excessively and they put on weight. So sometimes it's actually the opposite side of the pole. Um, there's poor concentration, and that has to do with what we call the cognitive aspects of depression. That's the cognitive symptoms in terms of how the thinking changes in terms of depression. There's poor concentration, there's poor memory, and sometimes this is actually people begin to get worried that maybe they are losing their memory. It's actually the depression causing that, and we do know that when that condition is treated, then that the memory gets restored. So there's poor memory, and then there's what is called the cognitive triad of depression, and I would just break that down to say what it means. It's a sense of worthlessness, a sense of hopelessness, and a sense of helplessness. That's worthlessness, helplessness, and hopelessness. And when these are present along with depression, sometimes it's also associated with suicidal thoughts, and those will be warning signs. And it's good for us to know these things because we should be our brothers keepers, we should be our sisters keepers. So when those things are present, it could actually be a warning sign that that person is beginning to contemplate suicide, or they are beginning to think that life is not worth living, and that will really be a reason to help to support them to get help. 10th of September, which is Thursday, is the World Suicide Prevention Day. So rather than go along with the next letter of the alphabet on that day, I'm going to be doing a video on suicide by God's grace. So we've talked about the cognitive symptoms of depression. And in addition to that, sometimes people think about suicide. Sometimes people actually commit acts of self-harm, or they may actually, at the extremes of it, attempt suicide. The other thing that we do know in terms of severity of depression is that it's also marked with anxiety. So people could have panic attacks, they could have phobias. I've mentioned about agoraphobia, fear of going out into open places, or fear of leaving home, or fear of being in traveling of traveling in public transport. So all of those may be associated with depression, in addition to the other symptoms that we have spoken about before. In terms of what are the causes of depression, because people say, what's the cause of depression? I think it's important to note that depression is a chemical condition, that depression is associated with chemical changes in the brain. We are not very precise about what causes depression yet. Several things have been mentioned, several things have been identified. However, we do know that there are certain conditions that are associated with depression. For instance, we do know that people who have suffered childhood adversity in one way or the other, maybe because of the loss of a parent very earlier on in life, maybe because they were physically, emotionally, or sexually molested or neglected, or that they were neglected, are prone to develop depression in their life, in their adult life. We do also know that certain physical health conditions, chronic physical health conditions, pain, for instance, chronic pain, cancers, diabetes, heart disease, thyroid problems, all of these are associated with an increased risk of depression. We do also know that what we call life events, in terms of life events, something happening in life that somebody is not able to cope with, a stress in life, loss of job, bereavement, loss of a marriage, loss of a relationship, loss of career, all of those could actually cause depression. However, notably, is also that the life events are not necessarily negative life events. Sometimes positive life events could actually also cause depression. Positive life events, like particularly notably, is now we are now beginning to talk about postnatal depression in men. men whose wives get pregnant and have a baby, and the man develops depression for several reasons. Um, the commitment of becoming a father, the sleepless nights, the fact that maybe this man has always been himself and his spouse before, and then suddenly all the attention gets diverted onto the child. We don't know exactly why, but people, financial pressures, but some men develop depression after they have a baby, just like women have postnatal depression. It could also be a positive thing in terms of a promotion at work, which then adds responsibility and adds stress, feeling of insecurity, feeling of not being able to do to perform the role. Sometimes as well, it's even things like house move. People say that one of the most stressful things in the United Kingdom is buying a property and moving in. It comes with all sorts of difficulties and all sorts of challenges. And sometimes people find that that could actually tip them over the edge. The thing to note is it's not always one single thing. It's usually a accumulation of a number of things that then result in people getting depressed. So what can be done? What help is available? And that's one thing I really want to put out there on these videos, that help is available. Please don't suffer in silence. Please don't let the stigma prevent you from getting help. Please do ask for help. The place to go to is always your GP to start with in the United Kingdom. In some other countries, it would be your family physician. Um, so that's really important. That's the place to get help. And there are a number of things that interventions that are available. There are talking therapies, for instance. Talking therapies, the common one, the most popular one, is cognitive behavioral therapy, CBT, and that has a lot of evidence showing that it is effective. It helps you to link thoughts to mood and mood to behavior. It helps people to be able to make the links between how they are thinking can actually lead to their mood, and their mood can then lead to behavior, and how to reverse that pattern, and how to identify rogue thoughts, which are dysfunctional thoughts, and to deal with them. So CBT is quite a very powerful thing. There are other types of intervention, interpersonal therapy, there's counseling, um, and in addition to that, there's also antidepressant medication. And I want to bust the myth about antidepressant medication today. People have myths that if you're on antidepressants, you're going to be on it for life. That's not necessarily true. A lot of people, only 50% of those who have one depressive episode will have another one in their lives. So, and usually the rule of thumb is usually to treat depression, to stay on the antidepressant for at least 6 months after the symptoms have resolved completely. Some of the reasons why people very quickly become unwell again is because they don't stay on antidepressants for long enough. So that's one of the myths. The other myths that people have is that antidepressants are ineffective. That's not true. We know that some people can. It's been lifesavers for a lot of people. The other thing is that some people feel that it will make them feel like zombies and they will be like robots. Indeed, some antidepressants may have side effects in terms of maybe nausea, maybe vomiting, but those are things that don't last for a long time. They are things that very quickly pass, and even when if they do, then you can consult your GP again and ask them to have that changed. So what I'm really saying is that it's always better to talk to a professional rather than pick up information. And do be careful with the websites you go to on the internet as well, because some of them do not give accurate information. So it's very important to talk to a qualified professional who has clinical experience, and they are qualified to give the advice and to demonstrate their expertise and to support you through your journey against depression. There are certain things that you can do in terms of exercising, in terms of having a structured day, in terms of reaching out for help. That's really, you can't overemphasize that, to confide in somebody, let somebody know what's happening to you. In conclusion, this evening, I also want to make a reference to an article I wrote titled Kingdom Nuggets for Dealing with Depression, or Kingdom Nuggets for Overcoming Depression. And that's in the November 2019 edition of Testify magazine. I'll be putting the link for Testify magazine in the chat at some point on the Facebook comments. So that's an article you might want to refer to just to get more knowledge and understanding of what depression is and how you can deal with it. Once again, I really want to say I appreciate the feedback I'm getting. Thank you for letting me know that this is being a blessing to you, and I look forward to tomorrow's video. Have a good night.